Hello and welcome to another episode of PodcastDX, the show that brings you interviews with people just like you, whose lives were forever changed by a medical diagnosis. I'm Lita.
And I'm Jean Marie.
Collectively, we're the host of PodcastDX. On today's show, we are speaking with Sharon. She runs a Facebook support group called IBD Journeys, an online support group for people with inflammatory bowel disease. Hi, Sharon.
Hi, Sharon.
Hi, Jean Marie. Hi, Lita. Thank you, and the audience. Thank you so much for allowing me to have the opportunity to come on here today and to share a little bit about inflammatory bowel disease and IBD journeys.
Well, thank you. We appreciate you joining us and telling us. Actually, Sharon, could you tell us what exactly is inflammatory bowel disease? Is it the same as irritable bowel syndrome?
It is not the same as, I always say, IBD is not IBS, and the two really get intertwined sometimes. And sometimes people with IBD can have IBS and vice versa.
Okay.
But just to clarify, irritable bowel syndrome, IBS, is a problem that affects the large intestine. It can cause bloating, abdominal cramping, change in bowel habits. Some people have constipation. Some people are on the other end of the spectrum and have diarrhea. And of course, it can always go back and forth between the two.
Okay.
And although IBS can cause a great deal of discomfort and definitely is not a really comfortable disease to have, it definitely is not IBD. And inflammatory bowel disease, it describes a group of disorders in which the intestines become inflamed, and it causes inflammation that unfortunately leads to bowel injury in most cases.
So bowel injury.
Okay.
What symptoms first led you to seek treatment? I mean, like, was it like worse than IBS?
Well, I have never been diagnosed with IBS, so I cannot speak to that. And I always say that
Okay.
when I'm talking, I say I can always only speak from my own journey, to say.
Right.
And unfortunately, my own journey started, now that I think back, I did have some, and I'm doing quotation marks, intestinal flu that didn't go away when I was, 5 years old.
Way back.
Yeah, way back when I was 11 years old, and then they hospitalized me, thought it was an appendicitis attack. It wasn't. They, just administered some antibiotics, and the intestinal flu went away. And then it came out again at 16, and then it went away. And then when I graduated high school, it was fast and furious. It altered my entire life. It was, I was going to the bathroom, bowel movements, 30 to 40 times a day.
Oh.
I probably lost,
Okay.
bloody stools.
Oh.
Had no control over my bowel movements. So what happened was I became a prisoner.
Yeah.
In my home, and I was 17 years old.
Oh,
so just imagine that, where the time where you're really coming of age, and I had to stop. I was really active in theater, had a really prosperous theater career. I live right in New Jersey, but New York was really close by,
Sure.
and it just stopped everything.
Oh,
and
that's
eventually, it stopped me going to college. Stopped. My friends dropped off. How many times, I can't make it. I can't, go to this gathering. And I just became so isolated. And that's the worst thing with this disease, that you become so isolated because it's not a pretty disease. You're going to the bathroom a lot. You're going to the bathroom in your pants a lot.
Right.
And so it holds a lot of shame too, right?
Mm-hmm.
And I just became a prisoner of my bathroom in my childhood home. And I remember taking a pillow in there and a comforter and just, would go from the toilet bowl to the bathroom floor. It was really horrible. Yeah. I'm sorry.
No, we feel
that
bad.
was part of the journey.
Yeah.
No.
I mean, that paints a picture that shows that it is completely debilitating.
Yeah.
I mean, you do not have a life at that point.
Yeah.
I did not have a life at that point. And I know in other cases, this can run from mild, moderate, severe, as many diseases do. But mine was pancolitis, which I was diagnosed with, in 1990, I was diagnosed with ulcerative colitis, and it affected my entire colon. It was just, yeah.
And she laughs now.
Yeah, well,
well, you got a positive attitude, which probably helped you get through in life, right?
Really has, and I do tell, well, I don't tell, I share with, my IBD Journeys members that hope goes a long way. And I don't think that's just isolated to inflammatory bowel disease. That can be even to anyone's adversities in life. And I love the acronym for HOPE, which is hang on, pain ends. And, I really just relish in those good days. Today is a good day. I woke up, I'm feeling great. So I'm like, okay.
That's awesome.
And it gives the hope for the next day and the next day.
That's really wonderful. Sharon, what causes inflammatory bowel disease?
Yeah, you know what? And even in the days when I was diagnosed, which seems like dinosaur days now, they really didn't have a specific cause.
Okay.
But recent studies show some combination of hereditary, genetic, environmental factors that may be causes. It could also be that the body's own tissues cause an autoimmune response.
Oh, okay.
Whatever causes it, the reaction continues without control and damages the intestinal wall, and it leads to all those symptoms I was talking about before: the diarrhea, the abdominal pain, the bleeding. And it has often been thought of as an autoimmune disease, and I like to think of it as an autoimmune disease.
Mm-hmm.
And a lot of the treatments for it are similar to other autoimmune diseases like lupus, MS, the rheumatoid arthritis.
Right.
And of course, within that immune system, that a body is attacking itself.
Right.
And so instead of this, the result of this, the immune system is attacking. It could be attacking a harmful or a harmless virus, bacteria, or food in the gut. And in those instances, a lot of people find some relief in dietary changes. But you know what? It's not a one size fits all. Some people, myself included, I can live off of gummy bears and whatever is working, for me at that time. Some people really find relief in taking gluten out of their diet. Again, not being celiac, but so it's a really unique disease for every individual.
Sounds like it.
It sounds like a lot of trial and error too.
It really is. We're complicated for the doctors, for sure.
Yeah. Well, and you said you have ulcerative. Okay, I'm not going to be able to say it. Ulcerative colitis.
There you go.
Okay, so is there more than one type of irritable bowel disease?
With inflammatory bowel disease, there's two major types: ulcerative colitis and Crohn's disease. And ulcerative colitis is limited to the colon or large intestine, which I don't have anymore.
Okay.
And Crohn's disease, on the other hand, can involve any part of the GI tract from the mouth to the anus.
Okay.
But most commonly, though, it affects the last part of the small intestine or the colon or both.
Okay.
And one thing here, because we get this in our group a lot, is when Crohn's disease affects the large intestine, a lot of people say, well, I have, Crohn's and ulcerative colitis. You either have the ulcerative colitis or Crohn's disease. You can have Crohn's disease that affects the colon, and I think that's kind of like, for me, I'm like, whatever diagnosis you want to, give to yourself.
Sure.
But I know that's the first spot for some people in the group. Like, you either have the Crohn's disease or ulcerative colitis. Ulcerative colitis affects the large intestine. Crohn's disease can affect anywhere. In the GI tract.
When you say it can affect anywhere, can it move? Like day to day, week to week?
It actually can. It actually can with Crohn's disease. You can have symptoms of the upper GI, which would be more of those stomach issues, stomach pain, the vomiting, the loss of appetite, and then sometimes, when it goes in remission, and hopefully it does go into remission for some of the patients and my friends. Then it could come out as, now it's affecting my large intestine, and then they may be having some similar symptoms as in ulcerative colitis.
Sharon, it sounds like this is a very intense condition. You said that you've had a portion of your digestive system actually removed. So there are serious complications with this and with having IBD?
Yes. And, I don't want to, get everyone scared out there because, like I said before, there is a spectrum, of IBD as any disease, the mild, moderate, severe. Some people have a bout of it, take some of the medications and are doing quite well. Some people, wax and wane between the two of mild, or the three, mild, moderate, and severe.
Mm-hmm.
Unfortunately, when it does become severe, as in my case,
right.
where it was severe from the get-go, there can be serious complications. And some of those are really terrible intestinal bleeding from these ulcers, which could also lead to low iron count, which I also had, a perforation, a rupture of the bowel. And I actually was when I was brought into surgery, that was the complication that was happening for me.
Because that's
my
very
large
dangerous.
Intestine,
right.
Yeah.
It was very dangerous. The large intestine was ready to perforate, and I had emergency surgery, and they removed my entire large intestine and rectum, and created a temporary ileostomy, which is, and that was all in my teen years. And then they resected it, and they made this thing called the J pouch. So I have like this man-made, how they call it is ilioanal reservoir. It's really actually innovative, even in the 90s. Now they've perfected it, but that's how I excrete my stool.
Right.
Mm-hmm.
But also complications could be strictures, which is narrowing of the bowels, which could lead to obstructions that you see a lot in Crohn's disease. Unfortunately, I'm also going through those right now, even though I don't have Crohn's disease. What I do have is a bunch of post-surgical complications of
Adhesions.
Concrete adhesions.
Right.
Yeah.
That's right.
Right.
That's right, Lita. And that has been wreaking havoc with my life as of late. And I don't want to scare your audience. I can only share my own story. From 2011 to 2016, because of these small intestinal or small bowel obstructions, I basically, and I like to say 50%, but my mother, God bless her, she keeps track of every single day that I'm in. During those years, I was an inpatient for almost 60% of the year. And when I wasn't an inpatient, I was on TPN, which is total parental nutrition. So it can get complicated.
Yeah.
Toxic megacolon can happen, which is life-threatening. Malnutrition always is something, even with the moderate and mild cases, because think about it, when your intestines are inflamed, they're fighting off something, and the permeability of it all, they're not really getting that nutrition that they may need. They're not absorbing the nutrition.
Sure.
So sometimes people can, get a PICC line or a port. I have a port right now where sometimes you have to get your nutrition that way. Mm-hmm. So it bypasses the bowel, and it also gives the bowel a chance to rest.
Okay.
I hope that makes some sense.
Yes. No, it does.
Yeah,
it does actually.
Yeah.
Right.
Yeah.
Right. I understand that. So your nutrition is going directly to the bloodstream, and it doesn't have to be absorbed through the intestinal wall to get into the bloodstream.
Absolutely.
Okay.
Absolutely. And I touched upon before, and I know this was kind of a question that came up organically with the autoimmune portion of it. There's also extraintestinal manifestations that may come about with IBD, which can be arthritis, skin conditions. As I'm scratching my head with my psoriasis in my scalp, inflammation of the eye, liver, kidney disorders, bone loss.
Oh, sure.
I remember I used to get a lot of these mouth sores when I was in a flare. Mm-hmm. Those were not fun at all. But it can affect different portions of the body. And honestly, my thought, and I'm not a scientist, but I did take a lot of science classes in college.
And you've probably learned through the years with your own problems that,
you learn through what you live through, absolutely. And it is just, I'm thinking that even all autoimmune diseases, I think that's like the big parent. And I think these autoimmune diseases actually have a lot in common where they can, because you hear, even with other autoimmune diseases, they can layer upon each other.
Sure.
So I think there's something with that. Like now.
I agree.
Yeah,
You're right.
Yeah. Like right now I'm going through psoriasis, or I'm going through, I always say I feel like I'm 90 or something because I have bursitis in both hips. Go figure, I'm like, oh, it's okay.
Right.
But it seems to me that autoimmune, that body attacking oneself, there's something to that, and we have to kind of find out what is the trigger for each individual person that's going through this and how to kind of turn that off.
Sure. Okay.
Yeah.
I know we kind of already passed, now we're into the disease, but how would they diagnose this in the beginning? You're not a doctor, but what tests did you have to go through? And
well, for and I do want to point out that if anyone does have any symptoms, if they're saying, oh my gosh, I've had intestinal viruses in the past, and maybe I have IBD, first and foremost, go to a GI gastroenterologist.
Okay.
Don't diagnose yourself.
Right.
And that's really important. It can be really scary out there, the amount of information, and I'm so grateful for your PodcastDX for having pertinent information and also researched information out there. But some of the tests that they'll make you do is a stool sample, and they'll look through an ONP and ova and parasites just to kind of rule out. So kind of like the tests rule out all those other things that could be causing those symptoms.
Okay.
Sure.
I remember having a stool test and ensuring that this isn't, from an ova and parasites, or it's not C. diff, going through, or E. coli.
Right.
Oh my gosh, there was so many E. coli scares with what was it, the romaine lettuce not too long ago.
Right.
And that can cause some more symptoms. That's exactly how it feels like. Think about if you ever had a really bad intestinal virus, or and had it for maybe 24 to 48 hours. This just doesn't go away. It's really debilitating.
That's incredible.
Yeah, it is incredible. And a total CBC. And honestly, I recommend that for every single person. If you haven't gone to the doctor, if you haven't had a total CBC, go get one done, just to ensure that all your levels are good. The big thing today, and this is for everyone, I'm generalizing for your audience here, is vitamin D, and check your vitamin D levels, because that can wreak havoc with so many things in your system.
Right. And a lot of us don't get enough. Yeah.
Oh, absolutely, because we're
inside all the time.
Yep.
We're not getting that natural vitamin D. For me, they did, and they don't do this too much anymore, but they did a barium enema. That was not fun. but really, what probably they'll do, and when I say they, I mean the gastroenterologist, is a colonoscopy, and sometimes they'll do the sigmoidoscopy, but really when they're up there, they're going to go through the whole colonoscopy. And a lot of people get afraid, oh my God, colonoscopy, I think it's the age of 50 where screening starts. You are not awake.
Right.
You don't feel a thing.
Yeah, I've had a couple.
Easy peasy.
Right.
It really is. The prep probably is the worst part, but really when you're think about IBD patients, when you're going so much anyway, it's really just your normal kind of bowel routine, you go so much. But colonoscopy, upper endoscopy, where they're checking, the upper GI tract, those are things that they really can go in. Sometimes, most times they'll go in and take a sample just to see, microscopically if your, intestinal wall has those features that are either ulcerative colitis microscopically or Crohn's disease. And that's a lot of times where they're differentiating between the two.
Okay.
That's great.
Yeah. It's definitely a different feature there. And the new thing, which they didn't have this during my time, but it's that capsule endoscopy where you're swallowing what they call is a smart cam, and the camera can basically take pictures and follow your GI tract down. The problem with that, though, I have to say, is if you do have a narrowing of the bowel, it may get stuck. So I think that they try to stay away from that one, if possible, especially with Crohn's. Yeah.
Wow, that's, you're kind of blowing my mind here. I'm picturing all of these tests. How long did it take to get that diagnosis then?
Okay, that's a great question, Lena. That is a great question. For me, fortunately, I was really not well for about a good 2 to 3 weeks, and recall how when I had those quote-unquote intestinal flus, they kind of went away in a week. And
so you kind of blew those off. Right.
Yeah, we blew those off. And but this time it was 3 weeks, and I still have for it's going on 35 years, and please try to find a doctor that works with you, works for you, listens to you. And I was fortunate to have one from the get-go, and he diagnosed me within 3 days of being in the hospital. Yeah, it was quick, but I have to say I hear stories more often than not of wow, it took me a long time to get an IBD diagnosis, and that really is sad.
Yeah,
because a lot of times, then people are saying, oh, you know what? There's nothing showing up. There's nothing happening. It's all in your head.
Oh.
You're nervous. You have anxiety.
Wow.
They'll put people on anti-anxiety meds when it's just not working for them.
Terrible.
Yeah. It really is. It really is. And then finally, when they get a diagnosis, they're like, yes.
Yeah.
Not that anyone wants it, but
no,
it kind of gives them
the knowledge.
Right. Relief
knowledge.
that it's not in your head.
Sure.
And then you get angry with the doctors. It's like, why didn't you see this last month?
But, yeah.
It is.
But
you're right.
Once they do find it, let's say you were diagnosed, is there medication that can assist you?
Absolutely. And there are actually a lot of medications now. It's not ever a great time to have any disease.
Right.
But in this day and age, 2019, they have a lot of things for IBD and still researching for things. In my day, going back there, the two things, and they still use them, was steroids and azolfidine or sulfa drugs, whether it was dipentum, azolfidine, or Asacol. That was new in those days. And unfortunately, I have a huge sulfa allergy, so I was just reliant. Yeah, I was just reliant on steroids. Okay. And unfortunately, they can't keep you on the steroids or high dose of steroids. Yeah, I have horror stories of friends that have had double hip replacements just because of not IBD or actually he has lupus.
But sometimes the cure is worse. Yeah, sometimes the cure is just as bad as the disease.
Right.
Yeah. Oh, that's so interesting. I was just reading Don Quixote, and that's one of the quotes in there in that story. Sometimes the cure, what is it? Sometimes the cure is worse than the disease.
Right.
Absolutely.
Right.
Absolutely. But nowadays they have some things that are called the biologics that seem to be really working for people.
And that's where they actually give you a stool sample, right?
Well, they go to infusion centers usually.
Okay.
Or sometimes they can, they have little shots, where you can kind of inject yourself,
well, that's
or
easier.
Infusion, Entivio. Yeah. And a lot of IBD Journeys members are finding a lot of relief with that.
Good.
That's wonderful.
Yeah, so I'm happy to hear about that, actually.
I was just wondering, have you ever had abdominal massage? And does that help at all?
Yeah. You know what? Actually, unfortunately, and if anyone is out there, and people know me in my group, and somehow, and I would love to, when we talk about IBD Journeys later, how that came to pass. But I'm kind of like the person that's like that open-minded skeptic. At first, I was a closed-minded skeptic, like my doctors are Harvard, Yale trained. I go to Mount Sinai, New York City, and Columbia Presbyterian, because my case was so high risk and unique. But and everyone's is unique, of course. But yeah, I've tried a lot of things.
Okay.
I've tried a lot of things. I have tried myofascial release massage.
Okay.
And I think that's the one that is, more what you're talking about. Sometimes it works for people. Didn't work in my case, but myofascial release can definitely, I would say, hey, try it. That's my whole thing. And you know what? Because it's so unique to the individual, I say I'm happy that worked for you.
Right.
Some things can work. Some people find relief in peppermint oil, or sometimes people find some relief in Reiki. I do Reiki at Robert Wood Johnson's Cancer Center, and some of my cancer patients, they say, oh, we find wonderful relief from it.
Right.
So I don't think it's a one size, especially with the complementary therapies. Definitely not a one size fits all. But you know what? Go and try it.
Okay.
I mean, some people find relief with soaking in hot baths,
right.
When they're having those strictures and everything. I say, hey, you know what? More power to you. Try it.
Well, in one of our favorite treatments or ways to escape from pain and such is traveling. And also, we have 2 recreational therapists here as co-hosts. So sports and exercise and getting out. But has IBD, obviously in the past, it really restricted what you could do. But nowadays, does IBD keep you from traveling or participating in sports and exercise and fun recreational activities?
Okay, that's a great question. When you're in a flare, and when you're in a severe IBD flare, just getting from your bed to go to the bathroom is a huge exercise. Just being able to, some people say, I took a shower today, after many days, and then I had a rest after a shower.
Right.
It can be so exhausting, and that's just not IBD. I think that's, when most diseases are in a flare. However, when symptoms are being managed, I've seen people run races. I went to Disney. I checked out every single Disney bathroom. That was really, and they're very clean too.
Oh, good.
It's a great place to travel to. But you know what? Like with any disease, if you're going to be traveling and you do have specific, medications or needs that if you are on a special diet, make sure to pack those with you. Make sure to check out. There's some great apps now. They didn't have those in my day, but there's great apps to say, what are your specific needs, nutritional needs, and I would definitely say check those out too. But I've seen a lot of members going out and exercising and traveling, and
That's good.
Great.
So there
great.
are chances that you can work yourself back into a sense of normalcy somehow.
Well, I think it's your normal.
Well, that's true. It's a sense of normalcy for yourself, then
right.
you're normal. Okay.
Right.
All right. Sorry about that.
Absolutely. And the big thing is just to know where the bathroom is.
Sure.
I mean, that causes a lot of anxiety. Where's the restroom? Where can I go? And once when you map out places, where that is, then it releases some of that anxiety to, oh my gosh, if I have to go and I have to go like immediately, how many steps, how many miles, how many,
right.
How can I get there?
Right.
I think that really helps and goes a long way.
That's
good. That's a great tool to have.
Yeah, exactly.
Right.
Yeah, that's
it really is.
And I can understand that being an older woman, I frequent bathrooms, and I'll give a tour, like we'll be driving and I'll say, oh, they have a good bathroom over there.
Mm-hmm.
Yes.
Oh, yes. She has made that comment more than once. Yep.
Yes, Lita. And it's so funny. When I was in my, flare-up days, my, I would, no, I wasn't, I did. There was like a lot of these side restrooms and, oh my gosh, I think I've seen everything. And another tip is make sure before you go, this actually happened to me this past weekend, when you go in, make sure there's toilet paper or bring toilet paper with you.
Yes.
So that's the worst thing.
Oh,
if you go in, you're like, oh my gosh, this toilet paper roll is empty. How many times you go to the bathroom and
Is
see
that
that?
something you then, if I ran into that on a regular basis, do you actually carry TP in your purse?
I carry baby wipes.
Okay.
Oh, okay,
Yeah,
okay.
I carry baby wipes.
Okay.
I carry a
do.
cell phone, and then I just call my daughter and say, I'm in the second stall. Could you please bring a roll of toilet paper over?
But yeah, we do wish you would check first. But yes.
Yes. If you don't have time to check first, I'm just saying.
Okay.
Yeah, and honestly, that's a great question, Jean Marie. A lot of members do carry actually even extra underwear and extra outfit in the car too.
Right.
Sure.
Yeah.
Sharon, I understand that you have a Facebook group for patients with IBD. And do you find that you not only share what you know, but you learn from others as well on this group?
Absolutely. And I just want to take just because if I don't honor Amy, then I didn't do my job. I don't know if you've heard the birth of IBD Journeys, and I was really, when 2011, when my bowel obstructions really came full force again, I was really in a turtle-like shell when I was in those hospital stays. I didn't talk. I didn't put the television on, and when you're in the hospital, you had a roommate, and I would just pull those curtains right around me, and I was in this turtle-like shell. I wouldn't talk to anyone. I just wanted to get right home, and there was this one roommate, and she wouldn't stop pulling the curtain back, and she wouldn't stop talking, and she was similar to my age, just a few years older. She had kids. I had kids. She had Crohn's. I had ulcerative colitis. She was going through bowel obstruction. So was I. And she was just relentless with talking to me, almost to the point of, oh my gosh, I think I'm going to get my room changed. But I'm really glad you can't imagine, but I'm really glad I didn't. And one day, I went down for a test, and, she got discharged, but she left me her phone number. And that was in August 2012. And when she left, when I got back up to the room, I said, oh my God,
she's gone.
I don't feel so alone in my disease anymore. I feel so fulfilled, and I feel like I have a life back. She brought a spark back into my life, and I'm tearing up when I'm saying this, because that's huge with support groups. And unfortunately, fortunately, we talked every single day after I got discharged, and then she had to go for surgery again for a bowel obstruction, December 25th, 2012. And she didn't make it out of that surgery.
Oh, I'm so
She didn't
sorry.
make it out of that surgery. Yeah, she left behind, her husband, 3 kids, and me, And I just went right on her legacy online.
Wow.
And without hesitation, I just said, you know what? I'm going to pick up this sword of advocacy and awareness, and I'm going to make sure that every household name, every household will know IBD, inflammatory bowel disease, and know that it's not IBS. And that it can be, a severe disease. Because people just think, oh my God, it's just a pooping disease. That's nothing.
Right.
But and sometimes, it is mild, but sometimes it can be very severe. And that people feel very alone in it, because it's not a pretty disease. Not that any disease is pretty, but and that's how IBD Journeys was born. And it was born just with like a couple of people in the group. Now it reaches thousands and thousands worldwide. It's when WeGo, it was nominated for WeGo Health nominations and a finalist one year. And it really is Amy's work, and she's like this angel over the group. So
how do you spell Amy? How do you spell Amy? A-I?
A-M-Y.
A-M-Y. Okay.
Yeah, Amy blew me her heart, and I can definitely, give her name out there, because it really is her legacy.
Okay.
And there are, from learning from the group every single day, I just learn from each and every member. And I always say, share your story. Share your story. People say, oh, but your story. I say, share your story, because you never know that your story may be the very thing helps someone else get through the day.
Sure.
Yep.
Absolutely.
So
Yep.
That's wonderful.
Well, Sharon, I would really like to thank you for spending time with us today. This has been very enlightening. And like you just said, sharing your story is hopefully going to be helping others out there.
Mm-hmm. Well, yeah, they're not alone.
Yeah, and that they're not alone in that journey. And I thank you so much, Jean Marie and Rita, for helping me share Amy and IBD journeys and inflammatory bowel disease with your audience.
Yeah, thank
Great,
you.
great.
Yeah, we have learned a lot because it is, it's something that, like you said, everybody should know about, and we really do appreciate you taking all this, the time to speak with us today.
If our listeners have any questions or comments related to today's show, they can contact us at podcastdx@yahoo.com, through our website, podcastdx.com, on Facebook, Twitter, Pinterest, or Instagram.
And if you have a moment to spare, please give us a 5-star review wherever you get your podcast. As always, please keep in mind that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment, and always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment and before undertaking a new healthcare regime. And never disregard professional medical advice or delay in seeking it because of something you've heard on this podcast.
That was good, Gene.
Yeah, I stumbled
Till
a little
next
bit.
week.